Good morning, everybody. Welcome to another Facebook Live edition here with Public Health Dayton and Montgomery County. Today, we're giving you a virtual media briefing, and we have a great panel of speakers here for us today. We're going to be joined by Montgomery County Health Commissioner Jeff Cooper. We have Mayor Nan Whaley with the City of Dayton. We have Sarah Hackenbrack. She's the President and CEO of the Greater Dayton Area Hospital Association. We have Michael Fuell. He's the President and CEO of Miami Valley Hospital. We have Terry Burns, Chief Operating Officer of Kettering Health Network, and Dr. Michael Doan, who's the Medical Director here for Public Health Dayton and Montgomery County. I'm Dan Suffoletto, Public Information Supervisor here from Public Health. We want to thank you for joining us. If you have not followed us yet on Facebook, please take the opportunity to follow us right now, because we will have a lot of great information for you here as the pandemic continues. We want to make sure that you're continually updated. So with that, I will go ahead and turn it over to our Health Commissioner, Jeff Cooper. Jeff?
Good morning, everyone. On behalf of Public Health, the City of Dayton, and our hospital system partners, we're pleased to be able to present to you today some updated information on the status of the pandemic within our community, as well as common messaging that we need to be giving to our community as this virus continues to spread rapidly and affect our loved ones. We're all familiar with the statewide Ohio Public Health Advisory System map. We've talked about it for multiple months now. The key message there is that when you look at the image of that map now, most of Ohio is red. That's a very disturbing trend that's happened over the last 4 to 6 weeks. 68 of Montgomery County's 88 counties are now red, indicating very high exposure and spread of the virus. Our test positivity in Montgomery County for the longest time was hovering around 4%. We are now at 11% test positivity. That number will increase by the time the new data come out next week. All counties in Ohio, including Montgomery County, exceed the CDC's high incidence threshold of over 100 cases per 100,000 population over the past 2-week period. That number is updated over a 2-week trend line. The last time we reported out to you, we were at 366 cases per 100,000 population for Montgomery County. As of yesterday, we are now at 520 cases per 100,000 population over the last 2 weeks. So when you look back over the time period of this pandemic, we had our first cases reported in January as a community, a few more cases in February, and then we started to see an uptick. And by June, we had about 1,300 cases reported to our health department. That increased significantly through July and August. And then we started to see a very slight downward trend in cases through September. But now we're on an uptick again. Over 4,300 cases reported to this health department in October. And through today, November 13th, almost 2,400 cases reported for November. For the longest time, we were around 50 to 60 cases per day being reported to this health department. We are now seeing approximately 200 to 250 new cases per day reported to us. So clearly we are on pace for the month of November to exceed 5,000 total new cases during the month. And that's a very disturbing trend. And the reason it's disturbing is that the virus is spreading throughout our community, and it's touching the lives of everyone that we know. Ultimately, what happens during this community spread is that, yes, healthy individuals may have minor symptoms and it's more of a discomfort. But ultimately, as we see increased community spread, more and more of our most at-risk individuals, our vulnerable populations, and our minority communities are going to be disproportionately impacted. And we're very concerned about the potential strain on our hospital systems as this virus continues to spread rapidly. So we know what to do. As a community, every single person listening to this news conference knows what to do, and we know the right thing to do. We need to wear a mask. We need to social distance. We need to avoid social settings of any kind. That means no game day watch parties, minimal size at wedding receptions, avoiding crowded spaces, not congregating in bars, no house parties, no extended family gatherings. That's a very difficult message to give, but it's a message that we all have to adhere to. We're at the point now where we should only be leaving our homes when it's absolutely necessary to do so. Stay at home when we're sick. Stay at home for the most part during the normal course of our duties other than attending work. We're most concerned about those who are elderly and those with weakened immune systems. So the virus is spreading rapidly. This isn't to paint a picture of gloom and doom. It's simply to reinforce the messaging that we've been giving all along. We've been very concerned about what was going to happen as we entered into the flu season and as individuals began to spend more and more time indoors because of the weather changing. And now that's becoming a reality. We're seeing it in the data, the rapid spread of this virus as we congregate more in indoor settings. So we know what to do. It's incumbent upon all of us to give a common message to make sure that we protect each other. We're seeing a significant number of outbreak locations throughout Montgomery County. So it's not just spread within the general community, but we're seeing multiple workforces affected. And the potential for that is that it affects our hospital system workforce, and it affects our public safety workforce and our public health workforce. Because as more and more individuals continue to gather in social settings, the virus spreads, and then we bring it to the work environment. And that's not what we want. Similar situation applies with our schools and our universities. So it's incumbent upon all of us as citizens of this county to take the actions that we know to do, that are right to do, to make sure that we protect each other. So with that, I will turn it over to Mayor Whaley, who has some comments.
Thank you, Commissioner, and thank you everybody at Public Health for doing just an amazing job this past 8-9 months now. You always do an amazing job, but particularly these past months that have been just so exhausting. Appreciate your leadership. So I know that to the media, we probably sound like a broken record. We've been talking about this since March, but we have been trying to ring the alarm on how serious this is, especially these past 3 weeks. You remember, I think about 4 weeks ago, Commissioner Cooper, myself, and Sarah Hackenbrack had a press conference at City Hall about this concern. We continue to see this rise, the number of incident rates over 10%, nearly 11% in this county. And then just if you think last week when we were shocked by the state numbers of 4,000, over 4,000 a day, now at 7,500 a day, you can see the exponential rise of what we're seeing with COVID. And we are very concerned, as we mentioned, going into the holidays and going into Christmas, particularly to protect the people that are working the hardest on this disease, which are our nurses and doctors in our healthcare system. Now, I'm very proud that Dayton and the Dayton region is not anywhere near where some communities are when we talk about bed rates. And I think that's the great work that Sarah Hackenbrack and her team and the team at Premier and Kettering have done to make sure that we are prepared. But I am concerned about their staff and the protection of their staff when we talk about just the sheer exhaustion of the number of cases we're seeing. And that's really what all of this has been about when we talk about how we're managing this disease. It's, it early on in March and April came to be about how we protect our healthcare assets. And so that's why we're here today. Again, I know these are tough decisions. I know we're tired of it, but we really, really have to make sure that we are doing everything we can to stay in our homes, to stay in what we call our COVID pods, to make sure that we're not mingling with others. You do not see me out and about as much because of this. And it's difficult on our businesses too. And so, again, we call on Congress to move a stimulus package because this is going to affect the economy, but we must be about health first and our health systems first. So I implore you all to continue to move this message, to make sure that people understand how serious this is, an 11% incidence rate in Montgomery County is nothing to sneeze at. 7,500 cases every single day in the state is serious. I remember, if you remember in March or April, when Dr. Amy Acton said that we could have nearly 10,000 a day, people snickered at it. We are there. We are there. And so we have to act accordingly. We need to act the way we did at the beginning of this pandemic, and we are imploring Daytonians to do that. With that, I'm going to turn it over to Sarah Hackenbrack, who's the head of GDAHA. These folks have just been doing a tremendous job at the hospital system, and that is what we are here to do, is to protect our healthcare assets. Sarah.
Mayor Whaley, thank you so much for your leadership. And Jeff, thank you for bringing everyone together to coordinate and speak with one voice to the community. I think that is one of the most important things that we could all be doing collectively. And we recognize that this week has likely been challenging and possibly confusing for many people in our community. Hearing the news, a very positive news that a vaccine is on the horizon, does not yet translate to us being safely through this pandemic. And that is why we asked our community to come together today to really ensure that everyone in the community understands that this unprecedented increase in hospitalizations in our region, as well as the impact that that is having on our hospitals, intensive care units, and supply and staffing demands, is concerning. We are alarmed at the rate of increase that we are seeing in this community. We're continuing to absorb that rate of increase safely in our hospitals in ways that don't impact patient care. But if that trend continues, we could be facing some of the same challenges that cities and states all across this country are already facing. And we don't want that to be our story. We don't want that to be the experience for people in our community who depend on our hospitals for care, but change is needed now. And so instead of talking to you about the numbers today, I've asked two of our hospital and health system leaders to join us to help you understand the impact from their perspective and to speak on behalf of our regional hospital community, 29 hospitals and health systems across 11 counties who have been working together and spending countless hours behind the scenes, ensuring that we can coordinate care for every person in the Dayton region who needs us. But we need you as well. And so first, I'd like to introduce the chair of our board of trustees, Mike Fuell. And Mike serves as the president and CEO of Miami Valley Hospital. And he's going to tell you a little bit about what he's seeing from an impact perspective within his facility, how it's impacting his teams, and then we will also hear from one of our other partner leaders next. Mike?
Good morning, everyone, and it's a pleasure to be here. And I'm joined by my colleagues who we're all working relentlessly to stay prepared and to continue to combat this pandemic. I guess I want to start by reassuring everyone in this region that our healthcare systems across the region are here, they're open, and we are prepared to take care of not only COVID patients, but also the non-COVID patients. We often get questions, are hospitals safe? And I can assure you that the hospitals in this region have done everything possible to make sure that the environment that our teams work in, our providers practice in, and our patients who seek care are safe. We've even had that validated by outside regulatory bodies that our processes and protocols that we've put in place to keep those within our facilities safe are in fact working. So we are here to continue to provide those services. What we have seen over the last few weeks, is a rapid increase, which is what you're hearing is impacting our hospitals. This is not about physical capacity. Back in April, March timeframe, we were all planning for a dramatic increase focused on how can we repurpose our facilities to take a very high volume of patients. What we're contending with now in this increase is our ability to care for the hospitalized patients, as well as the other part of the patient population here for other non-COVID related illnesses, whether they be medical or surgical in nature. So this is not a physical capacity issue. We have the capacity. This is about staff capacity. And we talked about staff capacity. our healthcare providers and team members are becoming exposed or infected to the virus, not in the hospitals, not in the acute care setting, out in the community, because of our inability as a community to continue to adhere to the basic principles which we have heard: social distancing, wearing masks, avoiding mass gatherings, effective hand washing and sanitizing. These very simple measures really sincerely help control the spread of the virus that can help keep someone to not be hospitalized for this. The numbers that we're projecting over the next couple of weeks are staggering. We're looking at potentially double increases in COVID hospitalization. Why that's impactful is we have a whole separate part of our patient population that is not COVID, that are here for needed services or illnesses, and we need to be able to care for those individuals as well. We do not want to go back into the area where we had to delay elective procedures or elective surgeries, because that also impacts somebody. And what we have here with COVID, while we can't control all aspects of it, there is a lot we can do to control it, and we all need to take a part in that to slow the spread down so that we can continue to have all the services and all the offerings for our entire patient population. The other piece that I think, and I know my friend and colleague Terry Burns will weigh on this as well, is we as a region, as health systems, have come together to make sure that we have a very robust plan to continue to care for the patient population, both COVID and non-COVID in this region, so we can continue to serve the communities with our high standards and high quality. So with that, I will turn it over to my friend and colleague Terry Burns from the Kettering Health Network. Terry?
Well, thank you, Mike. I appreciate, and I could, if I had a recording of your comments, I could start with those because I think you covered the waterfront of these issues that we're facing very effectively. I'm honored to be here today with all of you that are presenting, but also those of you that are in the news media that are helping us get the messages out that are very critical. I want to thank the mayor. I want to thank Sarah. Jeff, I think you laid it out very effectively, and that is that we dealt with an initial surge that began really for us in March of this year, even though the first cases were back in January. But as we came forward in March, we pretty much stabilized at a certain level. And as Jeff, as you said, it actually dipped just a little bit as we got towards the end of September. After September, it's gone like this. And we've seen, as Micah said, we have the potential to double the number of COVID cases that we're dealing with in a very short period of time. And certainly from September, the end of September, to where we are today in mid-November, we have substantially over doubled the number of cases. But we started planning real seriously together as a hospital association with Kadaha, of course with Premier, the entire Kettering team. We activated our command centers. Incident command centers are both activated, and those are regional command structures. We work closely with Montgomery County in and through and with Kadaha, and we have the capacity. We actually develop plans, the what-if scenario, the next step of how we can incrementally add capacity into the healthcare system. And we are implementing those plans today. I want to say that we still have a lot of way to go in that. And our goal is to not prevent patients who need care from being able to come in. We have things that we call elective surgery that in reality is necessary, needed medical care to relieve pain and suffering, and in some cases, serious medical conditions. And when we defer those, and we learned this in March, sometimes the patients get scared out of the hospitals, and we miss the opportunity to provide healing and help for patients who desperately need that. And so we're working to keep that side of our business still, of our programs, of the facilities operating at the same time that we're accepting more COVID patients and dealing with patients with other non-COVID medical conditions. I want to emphasize a point that's been said. Right now, if the trend continues, we could see a doubling of the COVIDs in a relatively short period. I don't know if that's weeks or a month. The current projections are all based on the use or non-use of these devices and whether or not we socially distance appropriately. Our message is a mask each time, all the time, every time, and strict social distancing. I want to share that we've been social distancing. We call it social distancing, but we all have kind of been walking by and with and near people, and we need to step back from that and actually keep our distance at all times when we're in an environment, what I would say is a mixed environment where there could be COVID. I'm not talking about doing it at home with your spouse or your children, although there's might be a place even for that. But the mask is vital to us suppressing the growth of the COVID now. If we put on the mask, over a few weeks, the curve will bend the right direction. And people say, what do we do? Put on a mask and strict social distancing. And if you don't need to go, don't. Stay at home during this, and we can bend this curve down, and then we'll get back to normal as the vaccine comes out. I'll let our next speaker pick up at this point, but I do want to say before that we have a great relationship with the hospitals here in Dayton. Certainly Kettering and Premier Health Partners are working closely together. We exchange data between our command centers so that we can assist each other in any way. And there's nothing that either of us wouldn't do to help the other. And likewise with the other hospitals in our region, the other 29 facilities that are part of GDAHA. And that forum lets us come together really to be the most effective solution for the healthcare needs during this pandemic. And we keep each other in our thoughts every day. Thank you.
Thank you, Mr. Burns. I'm Dr. Michael Doan. I'm the medical director at Public Health Dayton and Montgomery County. I wanted to make a few comments about the coronavirus vaccines because they've been in the news recently. The first thing, I guess, is that we're going to get a lot more information about these vaccines in the next month or two. The Food and Drug Administration convenes independent advisory committees to review each of the vaccines as the information becomes available. That is the point at which that information is public. And we can see what the process has been, how many people they've tested it in, what the results have been, so that all that information will be coming out over the next month or two. The FDA actually, in anticipation of this, put times in that they reserved with the review teams for the end of November and into December, so that they have the times there already and they're just trying to get that set up. Earlier this week, Pfizer announced that the vaccine they have is 90% effective. I think there was a lot of discussion about why Pfizer announced that at that point. I don't care so much about that. I think the point that I want to make is that we shouldn't lose sight of the fact that this is a remarkable level of effectiveness. Even if they're off by 5%, this is great. Dr. Fauci even seemed excited when he was talking about this yesterday. We had expected that we might get a vaccine that was 60% effective. But if we're talking about 80%, 85, 90% or more effective, that's going to be tremendously helpful and really change how things can evolve with this whole epidemic. The other thing is that there's people that are skeptical about the development process. They are concerned about influences, political influences, as well as the fact that it's just been so rapid, and problems with cutting corners and that sort of thing. I would like to say that they haven't cut corners, that all of the pieces that are normally there have been done to the same degree of quality as they would be in a traditional development of a vaccine. The difference is that they've done an accelerated process which overlaps the different activities. I think the seasonal example that we could use as a comparison is trying to fix a Thanksgiving meal. The traditional vaccine development would be you cook the turkey and you get that all done, and then you make the pumpkin pie and you get that all done, and then you do the vegetables and you get them all done. Well, obviously that's not how we do a Thanksgiving meal. And that, the turkey thaws while somebody may be making the pie and getting that ready. That goes in the oven, the vegetables are made ready, the turkey goes in the oven, the vegetables go in. And at the end of it, the table's set, the whole meal comes out, and it's all there. Everything that comes from those individual processes of cooking gets there. Everybody's got a fork. Everybody, the turkey's ready, the vegetables are there, you got serving spoons or whatever else, the mac and cheese. And that's the way that the vaccine has been done. So that it's not a matter of skipping things. The speed has come because they've overlapped activities. And one of the slower steps, for instance, is production of the vaccine in large quantities. The federal government paid for them to do that early on. So as soon as they had a vaccine that looked promising, and they started those first clinical trials, they also started to do mass production so that it would be ready very rapidly after the trials were over if it looked like a vaccine that was going to be useful. So that I think we should have some confidence that the quality of the vaccine is good. I guess the other thing is there's been some comments about the distribution of the vaccine. The two that are so far farthest along are the Pfizer and the Moderna vaccines. They both require ultra cold storage that's less than 80 degrees centigrade. We have those types of refrigerators here in Montgomery County. We know where many of them are. We're finding out where all of them are if we can. And we know who supplies dry ice as well to try and keep the vaccines cold. So I think it's a challenge, but it's not insurmountable. It's something that we just do because that's part of the job to get the vaccine out there. Also, there's been some comments about, oh, it takes 2 shots. Well, that's not unusual. I mean, I think all of us are supposed to get a tetanus booster every 10 years. The childhood shots, we know, our kids go get 1 shot and then they get the same shot a little bit later. As a consequence, this is not something new for us either. Because it's going to be particularly important, the state of Ohio is sort of ramping up and enrolling more people who will be doing vaccines and getting them into the system where anybody that's doing the vaccines can trace who's had it and who hasn't, so that we can do follow-up with people that need to come back for the second one, so that if somebody appears, they can find out they had the first one and that this is the second and it completes the series or whatever. So that as the vaccines come out, they're going to have different kinds of requirements to be successful, whether it's keeping it very cold, which will not be the case for all of the vaccines, whether it's 1 shot or 2 shots or whatever. And I think that the system is able to deal with that. And the sense I have is that the practice that the country has had, and particularly this region with H1N1 and the distribution with that, was sort of an ability from that to know what the hangups may be and what needs to be done. So that there are a lot of people working on that, and maybe that it's going to be kind of messy, and maybe that it's a challenge, but that's not a reason that it doesn't work and doesn't work well. The last thing I guess to say is just that, the summary is the vaccines seem to be effective, that so far the side effects have not held up the development, and that at this point, the vaccines will become available maybe sometime early next year. That would be particularly for healthcare personnel. For most of us, it's not going to be until much later, so that it may be months before the general population has a chance to be vaccinated. But it's going to be coming. Until then, we have to do what everyone else has been talking about, continue to wear masks, wash our hands, keep our distance. And that's particularly important right now as the cases are rising very rapidly. So Dan, I think I'll send it back to you. Thanks.
Okay, thank you, Dr. Doan. Some great information there for everybody. Remember to follow us to keep updates throughout the year as new information becomes available.